Assalamualaikum warahmatullahi wabarakatuh. Today I would like to share something about you, which is schizophrenia. Schizo means split and phrenia means mind. But schizophrenia doesn't mean split personality, but it refers to scattered and fragmented thinking. It's a syndrome with varied symptoms, generally grouped into positive, negative, and cognitive categories. What is positive symptom? These are psychotic symptoms. For instance, delusion, hallucination, disorganized speech, and catatonic behavior, none of which occur physiologically. Hallucination are a second type of hallucinations, type of positive symptom, and can be any kind of sensation that not actually there, including visual but also including auditory sensation like hearing voices or command. Then what is delusion? Delusion are strong beliefs that are not true, but the person fully believe them no matter how much proof you give that it's wrong. Now, what is disorganized speech? This is when the person's speech doesn't make logical sense or the words come out in a confused order. Disorganized behavior, on the other hand, could be like a person acts strange or unusual way, or when someone acts in a way that seems odd, random, or does not match the situation. Also, sometimes the behavioral is described as catatonic, which has to do with their movement, posture, and responsiveness. Negative symptoms are like a decrease in emotion they can express or lose of interest in things they once found interesting. One type of negative symptoms is called flat effect, where they don't respond with an emotion or reaction that would seem appropriate. Then another type is alogia, which means poverty of speech or a lack of content in speech. For instance, if somebody asks them, do you have any children? They might respond with just yes, instead of yes, one boy and two girls. A third type of negative symptoms is avolition, which means decrease in motivation to complete certain goals. So someone might stay at home for a long period of time without trying to reach out for friends or find work and job. Cognitive symptoms are like not being able to remember things, learn new things, or understand others easily. These symptoms are more difficult to notice and might only be detected if they have used specific tests performed. An example might be somebody not being able to keep track or several things at once, like a phone numbers and an address. People with schizophrenia will enter a cycle consists of two phases, typically in order. The first is prodromal phase. Patients become withdrawn and spend their time alone. This might seem similar to other mental disorder like depression or anxiety disorder. Secondly, active phase. In this phase, patient will experience the positive symptom more often than negative symptom and cognitive symptoms. Last but not least, patient enter into a residual phase where they might exhibit cognitive symptoms, then suddenly patient becoming withdrawn again. After that, they re-enter the prodromal phase. To officially diagnose schizophrenia, a person must have at least two of three symptoms, which are positive symptom and negative symptom. The other requirement in the one of the positive symptom must be either delusion, hallucination, or disorganized speech with negative symptom. Some people also have thinking or memory loss problem, but those are not required for diagnosis. To confirm schizophrenia, the symptom must at least 6 months. At that timeline, the patient must at least 1 month of strong positive symptom. The last one is the symptom cannot be caused by drugs or another medication condition. Now that we have diagnosed it, why does it even happen? What causes schizophrenia? One clue is that the majority of antipsychotic medication that improve schizophrenia symptoms block the dopamine receptor D2, which reduce dopamine level in the neuron. This suggests that maybe schizophrenia has something to do with increased level of dopamine, but it do not work for everyone with schizophrenia, which add to the confusion and means there probably more to it than just the D2 receptor. Interestingly, one of the most effective antipsychotic drugs, clozapine, is a weak D2 antagonist, suggesting that the other neurotransmitter system like norepinephrine and GABA modulation, serotonin antagonism, and glutamate hypothesis are involved. Twin studies have shown support for a genetic basis as well, even though there haven't been any specific genes conclusively linked to schizophrenia yet. Also, environmental factors like early or prenatal exposure to infection and certain autoimmune disorder like celiac disease have been linked with schizophrenia. Now, treating schizophrenia can be really tricky, and antipsychotic medication are often used. But it's super important to combine the effort of several clinicians and health professionals, including professionals in therapy or counseling, medicine, and psychopharmacology. Antipsychotics effectively reduce schizophrenia symptoms, but their use must be carefully managed due to the side effect, cost, and the needed for the long-term treatment. They are not addictive, but stopping suddenly can cause relapse, so doses should be reduced gradually under supervision. I think that's all from me about the schizophrenia. The most importantly is to improve your relationship with the God. That's all from me. Assalamualaikum.